And Dr. Awais Durrani in Houston, Texas. Good to have you with us. Almost 500 cases of measles have been diagnosed in Texas alone since January, with reports of more in neighbouring states. How worried are you now about this outbreak?
Yeah, thanks for having me. To be honest, I'm very worried. Measles is one of the most infectious pathogens known to humankind. And so once these outbreaks start, it's very difficult to control them. And so, for example, in Houston, which is in Harris County, we had our first confirmed case 2 days ago. We're hundreds of miles away from West Texas, where these deaths have occurred. And so this outbreak has now spread to numerous states as well: New Mexico, Oklahoma, other places. And the thing that worries me the most is we don't have leadership. We don't have leadership on a national level encouraging vaccinations, which is what's going to stop this outbreak from increasing more. And because of that, there's a lot of confusion. People are confused about what they should do when it comes to vaccinations, whether they should get certain treatments that are mentioned on air on various news networks or by certain healthcare leaders. And that's actually led to more detriments. There's been toxicities from certain treatments as well that have led to people being hospitalized and children being hospitalized. And so a lot of things are happening that are not good, in my opinion, and it makes me very worried.
Why is this outbreak seen to be so heavily centred on Texas?
Yeah, so this outbreak started in a community that has a very low vaccination rate. And so for measles, you need a 95% plus vaccination rate to ensure that there's herd immunity so that we're all safe. In this community, that percentage was very low. Now, when you get the 2-dose measles vaccine, it is 97% effective, but nothing is perfect. So that means that there's going to be people out there that got the 2-dose vaccine, did their duty, but that 3% chance that they still may get measles if they get exposed to it. And so the more exposures we have, the more measles we have in the community, it's going to make everyone unsafe. The fact also is that we have numerous communities like this that have that sub 95% vaccination rate. It's not just isolated to West Texas. There's communities all across the country. And so that's going to put all of those communities at danger, and then even those that did get vaccinated at danger as well.
Let's circle back to the leadership question then. What sort of leadership is RFK Jr. providing on this issue regarding vaccination for measles?
Yeah, not great leadership. You know, every time that this has happened before with other diseases, other outbreaks, other pathogens, we have had clear guidance when it comes to what doctors should be doing, what patients should be doing, what people that are worried should be doing. We have none of that. The few times that he has spoken out about this, he has, left vaccinations at the end of the list, and he's mentioned other things. One of the things I kind of alluded to is he mentioned vitamin A as a treatment for measles. That is not a treatment for measles. It is something that if you're deficient in vitamin A and you get measles, it can kind of help. But now what we've seen is that parents are giving their children vitamin A, and we've seen toxicity from that. That can lead to liver failure and numerous other issues, and children have been hospitalized for that. And so rather than helping and kind of giving clear scientific-based recommendations and evidence, what he's doing is actually making the situation worse. And that's what really worries me. We are just at the beginning of this, and we have almost zero leadership on this. And so local authorities, local public health agencies are left to carry the burden, and quite simply, they don't have the amount of resources that the federal government has.
Yeah, so when messaging is so important, in your professional experience, how difficult is it to win over vaccination skeptics in a situation like this?
It's very difficult. I see patients every day in the emergency department, and, they may not want a certain treatment, or they may not want a certain type of medication because they read something about it online. And even though I'll sit down with them and have a face-to-face conversation for 10, 15, 20 minutes, a lot of times I'm not able to convince them, even though we go over the risk and benefit. And so when a patient comes in with a preconceived notion about a vaccine or a medication that they may have read online, that's going to take numerous visits and numerous touch points to kind of reverse that. And unfortunately, in a healthcare system that is burdened, and one that has a shortage of doctors and nurses and PAs and all of the above, that makes our job extremely difficult, and it makes for a rough couple of years coming up ahead.
Dr. Awais Durrani, thanks so much for your input.
Thank you.